Okay, well, hi everybody on this drizzly early spring day in the Northeast. It's wonderful to see everybody here for this really important topic, which is strategies for effective use of Patient Gateway. Believe it or not, we probably spend a ton more time on Patient Gateway than you guys do. And a lot of us are patients also in the system. And so we have to use Patient Gateway. So I, as the section head for geriatrics, I'm very interested in what you all have been experiencing. And there's no doubt that I have not been through some of these things myself in trying to use Patient Gateway. So without further ado, I'm going to pass this on to Susan Edgman Levitan and enjoy the show.
Thank you, Dr. Levine. So welcome, everyone. My name is Susan Edgman Levitan, and I'm the director of the Stokel Center for Primary Care Innovation. So I want to just review some of the housekeeping rules before we get started. First of all, we mute everyone except for our speakers to eliminate background noise and make sure we don't have any interruptions in the presentations. If you want to view the speaker on your full screen, you can go up to the upper right-hand corner, and that lets you choose full screen where you'll see the speaker and you'll also see the slides, or you can go to the gallery view where you can see everyone who's on the town hall today. If your picture becomes jumpy or out of sync, click Stop Video in the lower left-hand corner where you see the little camera, and that will speed up your connection, but it will turn off your picture on the screen. For questions, please use the chat function. And one thing to be aware of, and that's right in the middle of your banner at the bottom of the screen. And one thing to be aware of is that everyone can see everything that's in the chat. So we really want you to avoid putting any personal medical questions or personal information that you wouldn't want to share with everyone on the call, because that could be a problem. But if you do have a medical question, we really encourage you to reach out to your doctor directly. So we want you to also post your questions on the chat, and we'll do our best to answer them. And we've already gotten some that you will see in the chat now. So I'm now going to introduce our speakers today. These are my wonderful colleagues in primary care, Dr. Michelle Leroux, who is our director of our clinical chief in our Division of General Internal Medicine and our primary care medical director. And then I want to introduce Dr. Larry Stratton, who is the medical director of our Everett Health Center. And he also is our in-house Epic expert. And Epic is our clinical electronic health record that you're going to be hearing about today that Patient Gateway is part of. So with that, I'm going to turn this over to Dr. Leroux.
Thank you, Susan, and thank you all for having myself and Dr. Stratton. We're very happy to be here. I just want to start by setting the stage a bit for what Dr. Stratton will go through, and then I will pick up after him around strategies. But, as you know, electronic health records have changed medical care in many respects, in many good ways. And one part is that you can see into your record. You have transparency and can see office notes. You can see test results, sometimes often before the physician even has a chance to see it. But you also have a means for communication on a patient portal. And for Mass General, it's called the Patient Gateway. It has various names at different institutions, but this patient portal is a two-way street. We as clinicians can send messages to you, and you in turn can send to us. It's convenient, which is wonderful. It can happen without having to have someone answer a phone. You can do it at any time of day. You can do it on weekends, send us a message. And so it has many pluses. But as you can imagine, the COVID pandemic led to some change in how it was used. And that's what I'm going to get into a bit after. Dr. Stratton speaks, but I'm going to turn it over to him first because I think to me, and it's still, I've been on Epic for a long time, there's a lot of hidden aspects to it that you need to know to really maximize the best use of the Epic and the patient portal. So Dr. Stratton.
So thank you, Michelle, and thank you, Susan, for the introduction. So I am going to do two things here. In a moment, I will show an overview slide of some of the core activities that a person might want to do in Patient Gateway. And then after that, I am going to be brave and actually do it as a live demo, which hopefully will go smoothly. So before I show the next slide, I'm going to apologize for its busyness, but again, 1 second. But the reason I set it up this way is because it does provide us an overview map that we're going to refer back to periodically during this talk about what are the key things that you might want to do in Patient Gateway. So it's really going to be broken into sort of 3 main topics. So the first one is broad concepts about how do you access Patient Gateway, how do you navigate it, how do you get help when you're there, and how do you make it work for you. And then beyond that, we're going to look at the home screen and the core activities that you can do there. And then lastly, I'm going to show 3 specific topics that are particularly useful or are slightly tricky and are worth learning about. Why isn't that working? So I should update this to say 4 questions we received because we just got one recently. And in the process of going through that agenda, we're going to look at these 4 things. So one is, how do I see doctor's notes, diagnoses, and tests in my chart? How can I share access to a daughter or a friend or other family member? How can I attach living wills or, in fact, other documents? And how do I view letters from my care team? Oops. I wanted to put this front and center, and we'll show you where you can find this periodically on the actual MyChart website. But there is an 800 number that is staffed by people who can provide technical support, either for logon problems or navigation problems. And it's staffed by people who are really patient and really helpful. So the first thing we were going to talk about is this core area of how do we access Patient Gateway and how do we navigate it. The first thing I wanted to show is that there are actually 2 different ways that you can access Patient Gateway, but they are equivalent. So I am going to be demonstrating it today on the desktop version, but many people may also want to have the phone version and use whichever one is your preference. So in terms of accessing MyChart, once you go to the main logon page, it's like accessing many other websites. And once you put in your username and password, it'll bring you to a landing page or a home page. This can be a little bit confusing to look at it first, but I want you to look at it in really 3 sections. So one is there are these main activity items up here at the top, sort of those 3 core activities: visits, messages, and test results. And then there's the menu option for sort of more advanced features. And then the part below is basically a running stream of current activity. So in this case, you can see that I got a message today from my PCP, and I have an upcoming visit that I might want to do soon, and so on. So the landing page is broken into those 3 parts. In terms of navigation, we'll see that as we start to look into some of these core sections. And in the process, I'm also going to show you some embedded videos that there are within MyChart that can help you if you get stuck. So on the home screen, again, there are these 3 main activities. There's the visits, the messages, and the test results. And within visits, what I want to show you is how can you look at prior visits and read notes or look at after visit summaries, and how you can look at upcoming visits. So if I go to my main home screen, I click on visits, it's going to give me two sections. One is upcoming visits and the second is past visits. We're going to look at past visits first. And it'll show you past visits with really any of the clinicians that you've seen at Mass General Brigham. But in particular, we'll look at this one here with Dr. Stratton. And I will show you that there are two things that you might want to see from that. One is you might want to see what's called an after visit summary. An after visit summary provides an overview of what happened at that visit. And because my screen is zoomed in, it's a little hard to see right now, but you'll see that it'll have information, for example, the vital signs that were obtained at today's visits. It'll have information about medication changes. So start taking this medicine, stop taking that medicine. And it will tell you where I sent the prescription, so where you should go to pick up your prescription, what labs we've ordered today, and what the follow-up plan is. In addition, it also may have some test results from today or from that visit, and it may have some attached information. So this here is an informational bit about the new medication that was prescribed. So the after visit summary is oftentimes the place to start if you want to remember what happened at a visit. Alternatively, I may want to actually see what my clinician wrote at the visit, to actually review their note. And this is a new feature that we added to Epic, I believe about 4 years ago, that allows patients to have access to view exactly what their clinician wrote. So by clicking on, sorry, let me go back to that for a moment. By clicking on the part where it says view notes, it actually takes me directly into the clinician's note, and I can read what they did, why they did it, what they found on physical exam, and so on. This is obviously a fake note from a fake patient, but it allows you to see that information. So the past visit information is incredibly useful for understanding and managing your care. The second part you'll see there is upcoming visits. And so in this case, I set up a virtual visit for this patient because I wanted to show a couple of things, but this will show any visit that's upcoming, including procedural visits like a CT scan and so on. In this case, I wanted to use this as an opportunity to highlight something about virtual visits. Virtual visits, as you may know, are a way that we can conduct a visit with our patients, either using video or telephone, and are an incredibly useful tool. If I click on the details box here, one of the things I want to show you is that if you scroll all the way to the bottom, there's a watch and learn video right here. And that's available on both platforms. If you want to say, oh my gosh, Dr. Stratton wanted me to do a virtual visit and I don't know how to do that. If you watch that video, it's about 2 to 3 minutes long. It'll walk you through each of these steps here and help you get connected to your clinician. Just while I'm also on the topic of navigation, one of the things I'll always show you is that oftentimes on these pages, there's a navigation button back to the home page. And I personally find that very useful to get me back to the home page. Mm-hmm. Second part of this is the messages page. If I click on messages, it's going to show me any message that I have received from one of my care team members. So in this case, again, it's a fake message. It's going to show me that there's this new message, and I have the ability to reply to that message if I wish to, saying, oftentimes there'll be a conversation back and forth, and Michelle will talk a little bit more later about how to use that. This, in addition to reading messages, you can also send a message to your care team. And the first thing I want to show you is that when you click on a message, it brings up a menu of what types of messages you might want to send. So one is you could actually just say, gosh, I don't really need to send a message to my team, but I just want to make an appointment for a follow-up visit. Dr. Stratton wanted me to come back, and now it's time for me to do that. So if you were to select this option, it's going to allow you to select a member of your care team and request a visit. And oops, let's just see. The second option under send a message that I want to show you is to renew a prescription. This is way more efficient for both the patient and the clinician than calling the office, waiting on hold, giving a message to the nurse, and requesting a prescription this way. If you actually use this feature, you can actually directly request a renewal of any of your prescriptions. So for example, the lisinopril here, I can request a renewal, and that will go directly to my care team, and I can just send it. And then that will come immediately, and the staff will begin working on it. But the last one that I wanted to talk about in terms of sending a message is actually sending a message, like a medical question. And Michelle, Dr. Leroux will also give you some information about what types of questions are appropriate. But I wanted to use this as an opportunity to answer one of the questions we received, which is, how can I attach a document? So let's say that I have a healthcare proxy form that I would like to send to my care team. I can say that I have a non-urgent medical question because it's not urgent. This is really bookkeeping. I want to send it to Dr. Stratton, and then I want to create a new conversation. So in this case, what I want to say is it's a healthcare proxy form. And here's the form you requested. And if you notice down here, there's an attach button. Many of you may be familiar with this from other types of applications on the computer. But if I click on attach, it's going to just pick up a standard browser window, and I can say, oh, there's Ted's healthcare proxy, and I can just attach that. And then now if I send that, that will go to my care team, and they will receive a copy of the healthcare proxy for the electronic record. That's the message section. In addition to attaching documents like a healthcare proxy, you can also attach photographs, and that can often be useful for certain situations. So the last section to look at is the menu section. And the menu section allows us to do some more sophisticated things, or things that don't appear on the actual main taskbar. So if I, sorry here. Hang out 1 second. So even I get a little tripped up here now and then. Anyway, the menu section is up here. And if you click on it, you'll get a whole list of things that you might want to do. And so the first thing that I want to emphasize is to use the search bar in the menu rather than fishing around to try to find what you want. So the three things that I'm going to show you are, how can you read letters? How can you schedule virtual urgent care? And then how can you share your chart with a family member? So if I just go into the search bar and say that I want to read a letter, it's going to just help me find the letters activity. And if I go here, you'll see that there's a letter from my doctor today, and I can open that up, and it will allow me to read the letter that my clinician had sent me about my test results, reassuring me that they were all normal. Second thing that I wanted to show people exists is that I want to schedule a virtual urgent care visit. What is this? So virtual urgent care is the ability for you to go onto your MyChart, select this option, and be connected to a clinician in real time for a virtual visit for a limited range of topics. So if I click on virtual urgent care, it's going to, in this case, give me a warning that I already have a visit scheduled. So we're going to ignore that. And it would allow me to, first I have to confirm that I'm in the state of Massachusetts. And then within the reason for visit, there's a range of things that I might say. Perhaps I wanted to have a virtual visit around a recent fever that I've been having. And I'd be able to select that as an option. This is one of the other places where there's a watch and learn video where you can, again, learn how to do a virtual urgent care visit. But again, the way to find that most efficiently is to just go to the menu section and use the search bar. There's one last thing that I wanted to show people that, again, is incredibly useful, which is how can I give access for my medical record to a family member or a friend. So the first thing is if I want to share my record, okay? And the first thing is something that's a little bit tricky, and I want to call it out so that people aren't tripped up by it. And it's the difference between something called Share Everywhere and Sharing Hub, sharing my record. So Share Everywhere is a way that you can give temporary access to somebody. So let's say that you're seeing a specialist at Beth Israel Hospital, and you want them to be able to see your record at Mass General Brigham in order to coordinate care. You could use the Share Everywhere feature to give that physician access to your record for a temporary period of time. Sharing Hub is really what I wanted to talk about. If you had incorrectly selected Share Everywhere, you would have pretty quickly figured out that it wasn't going to do what you wanted, because it basically says a share code will expire after 60 minutes, and then you're going to basically give an email address for who's going to get access to your record. You'd figured out that that's not how you give it to your daughter. But if you want to do the Sharing Hub, this is going to allow you to do a number of things. But what I wanted to show first is how can you give access to a family member? So if we go to Sharing Hub, we click on Family Member. And what I want to do is I want to manage ongoing access to my Mass General Brigham account. So if I select that, it's going to actually show that I've already given access to my daughter, Paula. And if I wanted to, I could remove Paula, or I could use the feature to invite somebody else. And if you select that, it's going to give you the opportunity to specify email address and so on about the person you want to share to, and they will be invited. So let me actually show how that works for Paula. So if I log in as Paula, sorry. When Paula logs in, there's going to be this box up in the corner where it says switch patient, and she can see her own record, or if she switches to TED, she can see my record. And you'll notice that, in fact, what she sees is identical to what I see when I log into my own record, because I have granted her full access to my record. So I know that that was a little bit of a whirlwind, and I expect there might be some additional questions, but I think those are the key activities that a person might want to do on MyChart. And they are ones that are incredibly useful. So I'll turn the screen back to Dr. Leroux.
My focus of the conversation is more around what has happened actually pre, peri, and post-COVID around patient gateway or the patient portal usage, which has notably changed. Understandably, in the midst of COVID, and I'll have you go to the next slide, please. In the midst of COVID, the only access to the physician, to the care team, was asynchronously. But then as peri and post-COVID, everything changed to a place that's not sustainable. If you look at the slides, you can see first on the left-hand side, these are the messages sent by patients. And then if you go to the bottom, you can see far left, 2019, we had approximately, this is primary care, approximately rounded up 200,000 patient messages sent from 160,000 patient population. Then you get into the middle of the pandemic in 2021, and we've doubled that, even more than that, more than 110% increase in the number of messages. But that was understandable because this is really the only way that patients were able to connect with their physicians and care teams. But the problem is post-pandemic, here we are in 2023, we may not be 110%, but we're nearly double of what we were pre-pandemic. And then if you look to the box on the right-hand side, that is basically just showing number of messages per clinician, full-time clinician. Pre-pandemic, approximately 143, and this is per month. But then if you go to in the midst of the pandemic, nearly 300 per month for full-time. And now post-pandemic, very, very minimal decrease. We're still near 300 per month. So unsustainable it has become for both physicians and for care teams. Because I think what many patients don't understand is that when a message is sent to a physician, let's say you want to send it to the person you saw, maybe an APP, maybe a physician, specialist, or primary care, it never lands in their, what we call their in-basket. It lands in a pool that is then managed, and it varies by division of where it lands. It could be with a secretary, it could be with a nurse, but it doesn't necessarily land with who you're addressing the message to. Because of that, because of the number or volume of messages, as you can imagine, care teams, but particularly clinicians, and I would say physicians, are spending an inordinate amount of time responding to these messages, both during their clinic hours, but well beyond the clinic hours, at night, on weekends, at all times. So I'll have you go to the next slide. And you've heard, I mean, it's not a secret that there's a crisis in healthcare and a physician shortage. And many surveys have been done to understand this better. I mean, there have been many components of the pandemic that have impacted care teams and physicians. But I think, and we know this is nationwide, it's not Mass General Brigham or Mass General, that the number of patient gateway messages has become unsustainable, so that physicians feel like they no longer have any downtime. They're responding morning, noon, and night on weekends, and really have no chance to kind of breathe in between their day-to-day work. And so we need to revisit how we manage these messages, but also revisit patient expectations, which changed during COVID, which were necessary. That was their way to communicate. But now we need to go back to the way it was pre-COVID and get people to understand how the importance of that. Not that we don't want to communicate with our patients, but it's not sustainable in the means that's occurring today. So next slide. So Mass General Brigham has recognized this is it's a crisis. We need to address how do we retain our physicians, our care teams, and make the job sustainable. And so they, want to look at what's coming in, so what's coming from patients, but also not just that, as a system, how do we manage these messages? We can be smarter about how we navigate the management of these messages, who manages what, and let's really maximize and optimize the use of Epic and technology to lessen the workload. So they created this MGB in-basket optimization team that I'm a part of, and had us basically tagged to one of three areas: technology, policy, or practice redesign, which is where I worked on, is how do we have the practices take these incoming messages and handle them differently to decrease the work burden on our care teams and on our physicians. But today, what we want to focus on is the patient expectations. And much of that actually came from the policy. What I'm going to share with you comes from the policy group of what MGB has arrived upon after doing numerous surveys and actually doing a national scan using consultants to better understand what are major academic institutions doing across the country to navigate this situation. So next slide. So it is really about, besides the work on our end of once a message is received, it has been about a re-education campaign around resetting the expectations of Patient Gateway. What happened with COVID is, because it was the only means, and where we're physicians, we weren't seeing patients in the office. We were on the portal as well, but from our perspective. And so messages were being responded to in a more rapid fashion than typically would be, because we weren't seeing patients. We weren't doing our other work because life as we knew it as a physician seeing patients shut down. So messages were almost, in essence, being answered in a text message or instant messaging modality, and in a rapid fashion that is not sustainable any longer now that we're back to seeing patients full-time in the office and doing our inpatient work that really was minimized, if not absent, during the pandemic. So for these reasons, we are wanting to reset a lot about time, about what is appropriate for messages. And that's what the policy group worked on that I'm going to share with you. So first of all, Patient Gateway is for short, brief messages. It is for several sentences, but not paragraphs. It is not for multiple issues, but really for a single issue that can be dealt with, maybe one response, possibly two, but it's not for a back and forth conversation. If, and I would say many of our practices, and I think this is true for primary care, I wouldn't be surprised if not the same for geriatrics, our nurses are really working these messages. They are the front line for receiving messages. And that's why you often hear from the nurse of the practice. They may say, this is too complex, you need to come in for a visit. Or the provider may say, have them come in for a visit. That's actually a positive thing. I mean, I think we're trying to get back to the way that best medicine is delivered. And though convenient, asynchronous or electronic care is not always the best care. And so we, as clinicians and the nurses, may say, no, we need to bring the patient in. The turnaround time is not what it was during the pandemic. We aren't on our computers as much as we were because we're seeing patients, we're in the hospital. So the turnaround time by the MGB policy group has been settled on to be 3 business days. So if you send a message, it may take up to 3 business days. And we're saying this because we have some patients either call or even send another message the following day saying, I'm not sure if you got my message. And we have, but the nurses are doing other work that they hadn't done during the pandemic. They're doing nurse visits, they're doing phone triage, that they may not get to the messages, but they will always scan them and prioritize and get to them within 3 business days. But we'd ask for not for you to call or to send a second message if it's still within that 3 business day window. They're certainly not for urgent messages. And we've had some real, I would say, near misses, really concerns on our part that we will see messages of patients having for chest pain, or I'm having numbness or weakness in my arm. That's new. This is not, Patient Gateway is not looked at on weekends. It's not looked at nights. And as I say, it's not sent directly to the physician. So it may not be looked at in a timely fashion. For anything that is urgent, please call, or if it's chest pain or whatnot, you may be directed to immediately either call the ambulance, or if you feel it's that urgent, please call 911. I just want to stress, it is not looked at on weekends or nights, and anything urgent is not safely managed this way. And even during the day, if it's an urgent issue, call. Do not send a Patient Gateway message. And then the last thing I want to stress is I've had patients say to me, like, how come you didn't respond? I don't want to talk to the nurse. I don't want the nurse to respond, or I don't want a medical assistant to intervene if it's a refill request. But the way Epic sets up the system and the way messages are delivered, it is never going to come to the physician directly. It will go to a pool of recipients, and it may be nursing. If you send a patient advice request that Dr. Stratton was showing, a medical advice question, that would go to a nursing pool. But if you send a scheduling question or scheduling request, that will go to a secretary pool. So it goes to different pools. It doesn't go directly to the physician. So I know and I want to stress, this Patient Gateway is a good tool and we want people to use it, but we just want it to be used safely for all of you, and also have you understand when there may be a delay in response. It's not that we don't want to answer, it's that it has this 3 business days, and either nursing or physicians are doing care of patients in probably face-to-face time, or in the hospital. That does not allow them to answer in a quick fashion. So I'm sure, next slide, please. I'm sure there will be questions, but I wanted to show you when you send a message in Patient Gateway, everything that I just said is going to be reiterated. You'll get a pop-up that says this is for non-urgent and there's 3 business day turnaround. But if it's truly urgent, call. And if it's immediate need for help, call 911. And then last slide. And then it just makes sure one more time, once you've sent, you can even learn more about Patient Gateway and all of these policies. They give you additional information. So it is there, but I also appreciate when you're sending messages, there's a lot of information that you're seeing and you may not have seen it, but it is living on the tool right now. So I'm sure Dr. Stratton and I definitely both want to take questions, and I'm sure there's some questions that have come up. So feel free to take the questions down. Thank you, Monique, for sharing those.
Thank you. This was incredibly informative, and I learned a lot about Patient Gateway that I was not familiar with. So I'm going to start, and this is a question for Dr. Stratton, and it's a question about, you showed how to upload attachments like a healthcare proxy, a living will, but I'd like you to say a little bit more about why you can't upload a MOLST form into Gateway.
Yeah, so that's a subtle point. So the original question we had gotten was, how can I attach a living will or a MOLST form? So living wills and healthcare proxy are documents that you complete by yourself or with family and friends that explain your wishes. A MOLST form is something different. It is a medical order for life-sustaining treatment, and therefore it's actually a document that you complete in person with your clinician. So it's it would be acceptable to upload a copy of a healthcare proxy or a living will, but a MOLST form really is something you need to do in person at a visit.
Thank you. I think you also showed about how you can add proxies or other clinicians that may be part of your care team that aren't at MGB. So that was one of the questions, but I think you've already addressed that. And I think you also addressed the question about how to see the doctor notes, your problem list, and your test and diagnostic information. But if people would like Dr. Stratton to go over that again, put it in the chat. But other questions that have come in are, what do you do? How do you deal with a mistake that you see either in your notes or in the after visit summary that needs to be corrected?
Yeah, so there are two ways to do this. And I'm going to just share my screen again for a moment just to show the way that it would be, let's see, the way that it would be done from MyChart. It's a little bit tricky to find on MyChart, which is maybe not the best. And it actually, you would have to kind of know where to look for it. So if you go down to resources, and then you go to technical support at the very bottom, technical support or frequently asked questions. If you go into frequently asked questions, there will be a section within this where it has a section on the chart correction unit. And it'll give you information on what is the chart correction unit, which is going to give you a little bit of expectation setting about how the process might go. But then there'll also be a section on what do I do if I don't agree with what's in the record or if I find an error. And that's the best way to do it. The other way that you might do it would be to message your practice, and perhaps one of the practice managers or one of the support staff might be able to help you find this, because it's a bit tricky to find, I fully admit.
Okay, thank you. There's also a question about when you are adding a proxy or someone else to MyChart, which is also MyChart is the name that Epic gives the patient portal, but we call it Patient Gateway. I just don't want people to be confused. Do you need to add the sharing person's name and email and password? What do you need to add? And I'm gonna,
Yes.
somebody's knocking on my door and I have to go open it. So go ahead, Larry.
Let me just show that. This is another place where, let's see, if we're going to go to, add a family member, and I want to manage somebody who's accessing my account on a long-term basis. If I go to invite somebody, all I really am going to need is a name for them and then an email address. And that's it. And then they're going to get an email that will allow them to log on and will have the appropriate links in it to link to my account. Now, if they are already a Mass General Brigham patient and they have their own Patient Gateway account, it will allow them to link it into their account. If they are not a Mass General Brigham patient at all, it's still going to allow them to create a Mass General Brigham Patient Gateway account to use simply as your proxy. One of the things that I want to emphasize at this point, though, is that this is by far the preferred way to share access to your family rather than giving them your username and password. People do resort to that, but it oftentimes causes significant confusion for your care team members. And so since this process is so simple, we really would want you to use this strategy. The other thing I will say is that this is another place where there's a video learning topic, where you can always go back to watch, get a 2 to 3 minute video on how can you share with a family member or a trusted friend.
Great. So another question that I think there's a quick answer to, but the question is, when you send the healthcare proxy, where do you find it? Do you have to find it in your photos? Where do you find the attachment? And Dr. Stratton, I think that's an easy answer.
Yeah, it is, when you,
I think they're asking about where do they find
yeah,
their proxy in their own documents.
that's exactly right. So when you click attach down here, it's going to bring up something from your computer. And it's going to default to your desktop. But if you had the document in another place in your computer, it would find it from there. In my case, I knew I wanted it on the desktop, so I put it there. But you could go to your documents or something like that. The one thing I will say that does trip up people occasionally, and this is sort of a subtle point, is that it only looks for certain types of files by default. So JPEGs are pictures, like of a rash, or a PDF is going to be a scan document. But if it's something else, you can always tell it, actually show me all files, and then it'll find all kinds of other stuff. But you would navigate for that just the way you would anything else on your computer.
Great. So, Dr. Rohr, here's a question that I think will be near and dear to your heart, and that is, why can't patients leave a telephone message at an MD's office and not post messages on Patient Gateway? That way, people might actually reach a real person.
Yeah, no, it's an excellent question. I mean, I think there's a couple reasons, and Susan actually and I work together on much of this, but the amount of work coming in on the phone is overwhelming. I will be honest with you. So the secretaries are not even able to answer in real time, and leaving the messages doesn't allow them to efficiently work those messages until actually something, maybe much 2-3 hours later. So to avoid, again, very similar to urgent issues or whatnot being lost or being delayed, we have what's called a phone tree. I'm sure you've all dealt with that. When you call into us, basically it'll direct you whatever your reason may be. But we need to have real live person, if there's a medical issue, talk to you, because we have triage protocols, meaning depending upon what you're calling in for, we can categorize the urgency and get you connected as soon as possible, if need be, either with a nurse or direct you right to the emergency room. So it is important we have a live person conversing with you in order to be able to do that triage protocol for safety more than anything.
Okay, thank you. Another question is, I think you answered, there was a question about what if Paula is not on Patient Gateway with a login, but I think you just answered that, Larry. So the next question that I think is also really important is, if a physical therapist sends someone exercises in Gateway, where do you find them? Or you showed the patient education section, but you may just want to remind people.
Yeah, so I showed the patient education section as a part of an after visit summary. But let's just see here. So in this case, here's a sample message of a message that I might have received, not one that I sent. And so if there had been an attachment, say with some exercise instructions, it would have appeared on this page here. You would have gone from the conversation list here on your messages. You would have opened that message, and then there would be a link there where you could open an attachment. Sometimes it can also be embedded in the message itself, but more likely it would be an attachment there.
Okay, thank you. So I think the last question that we may have time for today is, someone has recently found that under visits, the actual time of a scheduled procedure is not indicated. Why is that?
Well, without knowing the specifics, I can only speculate. And so certain types of procedures actually, will specify an arrival time and not an actual procedure time. That may be one factor. And I guess I would need to know a little bit more specifically what the example might be, whether it's like an imaging procedure or surgical procedure or a colonoscopy or some such thing. I think all of those should typically specify an arrival time, but I'm likely mistaken given their question.
Okay.
I guess, that would be a situation where, that would be a very appropriate question for your care team. Like, I'm scheduled for this procedure. It says it's on Thursday. What time do I arrive? Right? That's a very appropriate question.
Oh, the person said neither arrival nor procedure indicated. I don't know if you want to say more about what kind, whether it's a surgical procedure, some sort of imaging or radiology procedure. That might help us answer your question a little better. So, a GI test.
I don't know the answer to that, because typically if something is actually scheduled for a particular date, there usually is a particular time, and I would have expected it to be there also. So there is an appropriate response here that many surgical patients are not given a time until the day before. But yes, contacting the office for more information is indicated.
Yeah. All right. Thank you so much. This was incredibly informative. And I'm going to give the last word to Dr. Russell from our geriatric medicine practice. So go ahead.
Great. So I just want to say thank you so much to Dr. Stratton and LaRue, and also to you, Susan, for moderating this. Communication is always the thing we want to be excellent, and part of being excellent is to be digestible. So I think knowing how to find your information and how we can communicate most effectively with you, this has been a really eye-opening experience for us, because I don't see the patient side of things, and it's nice to have had that orientation. So appreciate this very much. And as Sharon said, please go and enjoy the rest of our drizzle day. And it's, as I said in a meeting earlier today, it is a grilled cheese and tomato soup kind of day.
Yes.
Best wishes to you all.
Yeah. And I also just want to remind people that our next town hall is going to be back in the creative realm. And we're hoping to host an entertaining, not that today wasn't entertaining, but an entertaining talent showcase in the spring. So I hope everyone enjoys the rest of your day, and we'll see you next month. Thank you. And thank you so much to Dr. Stratton and Dr. LaRue. This was really a terrific presentation.
Thank you.
Thank you.
You're welcome. Thank you so much.
Bye-bye.